Welcome and thank you for joining. My name is Dr. Jason Taylor and I'm a gastroenterologist and advanced endoscopist at St. Luke's Hospital in St. Louis, Missouri. The purpose of this video is to talk about our recent manuscript, Top Tips for EUS-guided Evaluation and Sampling of Pancreatic Cystic Lesions. In addition to discussion of this topic, we will have a hands-on demonstration with this video. So why did we choose to write about this topic? The importance of this topic is for those patients that have pancreatic cysts. And pancreatic cysts are very common, anywhere from 2.4% all the way up to 15% or more in the population. And the prevalence increases with age. So as gastroenterologists, as advanced endoscopists, we see this commonly and we get referrals for this commonly. So how do we decide what to do? Well, that was the purpose for writing this paper, and the goal for it was really to discuss those topics that are high yield for not only before you see the patient, but planning for the procedure, doing the procedure, what to do as far as management, and then what to do afterwards. So in discussing these tips, we've gone through everything from how to sample a lesion to what type of needle to use and other equipment that can be done for it. At this time, we'd like to show you some of the equipment that we use for sampling pancreatic cystic lesions. There's a through-the-needle forceps that we use. It's shown in not only in real time on EUS and the video footage that's associated with our manuscript, but we're going to have a hands-on demonstration now for those practitioners that are using these forceps or wish to use the forceps in a how-to-do session. Welcome to the hands-on portion of our video today. We're going to talk about some of the equipment we used in our advanced endoscopy suite here at St. Luke's. We have some equipment here to show you guys today. For those that have used it before, thank you for joining us, and those that haven't, then welcome to the new equipment. So this is the through-the-needle forceps, Steris micro forceps. They go by many names, Moray micro forceps, and they're forceps that go through our EUS needle. So I'll have Pat have that one, and Karen has our 19-gauge EUS needle that we're going to put the forceps through. We cannot use a 22-gauge needle because the diameter of the channel through this needle doesn't fit these forceps. Look at the outside of the pack if you have questions for whatever your equipment is. Again, this pack will show that this is only 0.72 millimeters that it'll fit, and this pack says this is 0.9 millimeters, so clearly it doesn't fit. So make sure you know what equipment you're going to use, but once again, use the 19-gauge needle. We use the Expect Slimline needle from Boston for this. So we have our needle here. With our needle, you're going to unscrew this portion so you can take the needle and puncture the cyst. See the needle comes out of the EUS-FNA. And then you're going to, once you're inside the cystic lesion that you want to sample with your through-the-needle forceps, you're going to take out the stylet. So take out the stylet. Set that to the side. Like that. You hold there, I'll lift this up.
Make sure they're closed before you put it down.
Okay, now we're going to put the through-the-needle forceps through the EUS-FNA needle. Before you do this, and once again, our needle is out.
It went back in.
This needle is out. Remember, we're punctured into the cyst. And if you want to lock it so it doesn't go farther, you can lock it once again on your EUS-FNA needle so the needle doesn't go any farther as they're moving the forceps through. Before you do this for the first time, hopefully you've done it many times in practice before you do it on a patient. Before you do this the first time, make sure you know the distance that that the forceps are going to come out through the needle, because it's not all the way to the hub. So the forceps, as you can see here, are out now. Pat's going to open them. You can see the forceps open. This part of where it's open here, this black sheath on these through-the-needle forceps is not all the way hubbed to your FNA needle. There's a distance of about, using my measurement tool, about 4 centimeters. So that's the distance you're going to have, 4 to 5 centimeters, before the forceps actually, let me bring it back just a little bit, maybe 5 centimeters before the forceps come out through your needle. So once it's out, then you're going to biopsy the side of a cyst wall, the mural nodule, the solid portion of the pancreatic cystic lesion, which is the purpose of the tool. So when you do this, you'll actually have a tactile sensation. I'll let Pat talk about that from the technician or nurse perspective.
Right, so it's just like any other when you're doing biopsies. When he tells you to close, you close, and you can feel if you got some tissue. The first time I used it, I told Dr. Taylor, I don't think we got anything, and sure enough, we didn't. So when we went back down, I said, oh, I've got something. And he could also feel that. So when we pulled it out, we did have our little microbiopsy.
And you have a piece of tissue,
yes,
which is great. Now, once it's in, we don't actually have to remove the needle from the cystic lesion. So if you want more tissue, which pathologists always want more tissue, and so do we. So if you want that, you can simply put the forceps back through again and get more tissue, however much you need. The more you sample the sidewall of a cyst or the lesion, the more you scrape it, the higher your risk of pancreatitis, and it is more than the standard risk of pancreatitis of less than 1% with the US FNA. So in summary, using the through the needle forceps with this is very straightforward. I think remembering the top tips that we talked about in this demonstration today is really making sure you know what distance it's going to come out. You can obviously see it on your EUS screen. Having people that you work with that are experienced, and if they're not, letting them know what is going to happen before it does is very helpful. And then finally, when you want the right piece of tissue, remember you should feel that tactile sensation, both you and your nurse or technician, to make sure you have an adequate piece of tissue. And the good news is you'll know, because when you go to put it in the container, you'll see it. And if you don't, you try again. So thank you very much. So now that we've seen the through the needle forceps used, and you're all familiar with that, we're summarizing those top tips again that can be used for the procedure, and we won't go through all of them today in this video as are outlined in the manuscript, but it's important to know that preparation really is the key tenet of this procedure. Because if you don't have the equipment, if you're not ready to do sampling, if you haven't discussed the risk with the patients and you're not ready to act upon those results with the patient, then once again, the procedure is not necessary. So make sure you're prepared, make sure the patient's prepared, make sure everybody's on the same page. Consent is done in the proper fashion. And I think that your outcomes, not only from what you're yielding with the top tips in this paper, but also with patient preference and satisfaction will be much higher. So the question becomes, what fluid do you send the pancreatic cyst for? We talked about in our manuscript that the importance in the standards are sending for CEA, sending for glucose, sending for amylase, and sending for cytology. But sometimes the diagnosis isn't easy, and you get the results back and there's confounding results, so the results are definitive of what you're supposed to do. In fact, that's when the through the needle forceps are used. And you take the tissue and you send those, and even with that, the results are still difficult to interpret, or they're simply not straightforward as to what should be done next. One other thing that can be done is sending the pancreatic cystic fluid for molecular testing. I personally send the fluid for pancreatic cyst fluid results, and the remainder of the fluid is saved for molecular testing. So if we need that, if there's a diagnosis in question, then that very same fluid that we already collected can be sent off for molecular markers. Thank you very much for joining us today. We really appreciate your time in watching our video and watching our hands-on session, and appreciate you reading through our manuscript as well. And we hope that these tips are helpful for you and that you've enjoyed your time. Thank you very much.